Okay, everybody. Hello. Um, I am doing this video for you Monday, May 18th at 2:11 p.m. All right. Let's just talk about a couple of things. Number one, let's just start right off the bat. Positive about this course. Don't worry about it. I'm here to support you. So take a deep breath in, let it all out, and don't worry about it. That being said, this is one of the most difficult courses in this program. Don't worry about it. It's okay. You'll get through it and you'll be successful. A lot of you are being successful. I want you to know that. Now, a couple of things in reference to this video will run probably over 10 minutes just to give you a heads up. And also, if I make these videos and do communications with you, just know that it's extra time that I give you to really help you be successful in the course. It is up to you whether you review them or not. That's up to you. If you don't, then it's really not of service to you as a student. So when I do these, it's really to help you guys. All right, so Zoom assessment questions. Also, I have another whole Zoom video I created on Screencast-O-Matic, and I provided a public link to it to my actual Screencast-O-Matic account. So you have access to that video. I posted it in an announcement that discusses the process of Zoom and scheduling Zoom meetings. So I don't want to add any more about Zoom here, except for the results. Over 95% of you did not feel the need to have Zoom meetings at this time. That said, it is okay if there are just a few of you that want a Zoom meeting, and the Zoom meetings will be recorded for you, as I state in the video. I don't want to mention too much about it. But for those of you that need it, go ahead and sign up via the instructions I gave. And if there's only just 2 or 3 of you or 4 of you that we do a Zoom meeting, that's fine. And it'll be recorded anyway, and it'll be posted for anybody who wants to watch it. And it'll be posted within the Zoom section of the course. So again, you'll see that when you look at my Zoom video I made in Screencast-O-Matic. All right, so some people are expressing that they're concerned about being successful in this course. Remember, I stated this is one of the most difficult courses in the program in addition to the capstone. Although I feel like this pales in comparison to the capstone in reference to the difficulty level. Capstone is very hard. But this part of the course is really helping you to be successful in the capstone. So let me just go over some helpful hints on how to be successful in this course. So I'm going to take the video part and kind of pull it over my other monitor here so I can watch this, and then I'll hold things up to the camera as I have to. So I'm looking at Canvas. Okay, I'm looking at Canvas, and I'm in the Module 1 overview of pulmonary emboli. You see that it explains a very nice overview about pulmonary emboli. So the learning outcomes. Someone asked me about explaining learning outcomes. That's fine. They're pretty broad because you really have to typically learning outcomes are generally specific, but for this course they're broad because you have to take a lot of information into consideration when taking the quiz/exam questions and when doing the discussion questions. So it's really hard to make them very, very specific. So I'm going to break it down and make it easy for you. So we're going to talk about discussion questions, and then we're going to talk about the quiz questions, so what to expect on them in addition to the exams. So again, I'm taking a deep breath now just to show you that it's going to be okay. All right, something very useful. Remember, I told you there was a methodical approach to being successful. Oh, there we go. That's so much easier if I show it to you like that, and I can view it on the other screen with the camera, okay? This methodical approach to doing the discussions and doing well on the tests right here, folks. Right in your case discussion. And we're reading chapter 13 this week, and in your textbook, pulmonary embolism. Okay? So I'm going to break it down really easy for you. So, with discussion questions, number one, rubric. Look at the rubric. to make sure, because it says about having additional references to substantiate your claims, and then be very accurate when you explain yourself in the discussion questions, okay? Don't stress about it though. Now, if I look at the pulmonary embolism case study, you guys see, I read through all of this just like you guys do every single time. Any course I teach, I read everything again. I read the textbook chapter as well. Honestly, a lot of the textbook chapter is covered in the discussion question, but disclaimer, there are some things in the textbook that are on the test. So I read the textbook as well. And also, if there's anything within the course content, because the first learning objective, interpret the findings for representative chest radiographs, echocardiograms, electrocardiograms, pulmonary function studies, and arterial blood gas assessments from cardiopulmonary patients using cardiopulmonary assessment methodologies. I'm going to break it down for you using this case study as an example. And then learning objective 2, evaluate the various assessments used in differential diagnosis of patients with cardiopulmonary disease. Again, broad objectives, but I'm going to use this simple case study to break this down for you. Remember, it's a methodical approach. Hint, hint for discussions and your test/quiz questions. History. Look at the case that is presented to you within each of the quiz questions. Look at the case. You're gonna remember there is this methodical approach to these. History and physical examination. And if you go in and we look at the first things within pulmonary embolism here, granted, it gives you about practice essentials, but it goes in and it talks about here on page 2 of my printout, signs and symptoms. But we're going to do history and physical. We're also going to do signs and symptoms, differential diagnosis. So you're going to look at, when you look at these, okay, when you look at these differential diagnoses and then you look at diagnostic testing and what specific tests really help diagnose a pulmonary embolism, you're going to pay attention to the most important ones. Okay, hint, hint for test questions. So, history and physical, signs and symptoms, differential diagnoses, what do we do? And then, how do we diagnose? What clinical, using chest radiographs, echocardiograms, electrocardiograms, pulmonary functions, arterial blood gases, etc. And then what clinical assessments are we going to do as well? There's your methodical approach to these case studies and your test questions. Also, as I go through this, really, really big thing, treatment too. If you follow this methodical approach, you will do fine in this course. I can't say it enough. I've probably said it, 5 times already? It's because I really want you guys to do well. Okay, so I'm going to repeat myself just to help you do well. And then, so really important to think is, how do we treat this? And where do pulmonary emboli typically come from? It is a break-off from a clot in it's usually in the lower periphery. It usually comes from a DVT, right? Typical test used, accurate test, that's even more accurate than a pulmonary angiogram is a CTA. Hint, hint. Let's leave it at that. What are the most important things that are going to help you diagnose? Where does it come from? So, that being said, in chapter 13 of your book, part of this methodical approach, etiology and pathogenesis, you've got to know that information. Then it goes on to talk about pathology, pathophysiology, clinical features, diagnostic evaluation. Then it shows x-rays, imaging, pulmonary angiograms, CTAs, x-rays, treatment options. Again, read both the textbook and the case studies and additional features that will help you as well in all the assessments or assignments within the course. So again, take that deep breath. It's okay. Everybody's going to be fine. All right. And then, so we go into management, and then within this case study, remember, I'm going to give you answers, but that's okay. If we look at this here, treatment, all right, you just saw some answers, even on the quiz, sorry. There's some things in here, so what are some treatment options? Again, what are my most successful treatment options? You're going to have to do additional research on this, okay, to answer this properly, and that will also come into play with your test questions. And then background information just on the different diagnostic procedures that it gives you within the case study, anatomy of it. Again, it talks in the pathophysiology, etiology of pulmonary embolism, in quite detail, and risk factors associated with it. And then it goes on to talk about pulmonary embolism in children. That's not really, one of the case studies does talk about that, so just in reference to your tests, so just be available for that. If memory serves, it doesn't really, it's children and adults, so you just may have to know about a certain statistic, that's all, and I'm looking at it. It's right in the beginning of pulmonary embolism in children. All right, then it talks about epidemiology, or the in the United States, the incidence and disease progression and study. And it just goes on to talk about other statistical information, prognosis, patient education. Then it takes you back to that methodical approach to approaching the case studies and your test questions or quiz questions. And again, it's repetitive information. It goes over certain things that I printed out. But if you go through that methodical approach to doing this, you're going to do fine. Just really strong. Remember, recap quickly. I'm already at 12 minutes. History and physical. Then we're going to look at signs and symptoms. Then we're going to look at differential diagnosis. We're going to look at how to diagnose differential diagnosis, diagnostic procedures used. What are your most important diagnostic procedures to use when diagnosing a pulmonary emboli? Where does it come from? The pathophysiology of it. It comes from they typically most likely come from a DVT. Okay, clot break off, piece of the clot goes into the pulmonary vasculature, and then you have a PE. Also, having that background information in addition to treatment options is going to help you significantly comprehend the discussion question in addition to be able to answer the test questions accurately. Hallmark diagnostic procedure for a PE, not the pulmonary angiogram, CTA, guys. I just gave you a free test question. All right, or part of one. People are putting, I see in the discussion question, pulmonary angiograms. That's fine. But if you read the fine details within the actual discussion question, it's a CTA. So that's how you're going to be successful in this course. So relax. Also, please, I am here for you guys. I'll do these videos. I will do them at crazy hours sometimes. I just happen to not be at work this week. But I do work a full-time job on top of this, and I generally answer emails and other questions in the evening. If you send me a quick email, by the way, during the day, and or, hey, professor, like the quiz, my quiz grade, ask about a quiz grade or something that I can quickly answer. I do answer those emails pretty quickly during the day. If it's more extensive, some people do send me extensive questions. I can't always take that much time away from work. I will, in the evening, I'll answer those longer emails for you. Again, I'm here for you. If you're a student that you've had me before, I'm willing to work with you. Again, we're in unprecedented times. I'm beyond stressed as well. I wish I wasn't. But I just want to make this course as stress-free as I can. If you'll notice, I did do a curve on your grades for quiz 1. It's because I look at a quiz statistical analysis in Canvas. When I look at that, that means I have it generate reports, and I look at specific questions that everybody got wrong, or that the majority of the class may have gotten wrong, and then I adjust the mean average within Canvas, and it will adjust your quiz grades. There is a fluke at times where if you had maybe you had a mean average of 36, and I did I curve grades for the quiz. Sometimes it'll take you a point or two lower when it really should have taken you a point or two higher. Really, if you're up, so it curves in 3 different groups. If you're in the higher group, it typically will pull you up to the higher grades. I had someone email me about that. I don't know why there was a fluke. I did answer and address the email. If there is a fluke in your quiz grades, let me know, especially after I curve them. Remember, the way the quizzes are graded is the average of 2 quiz attempts that's in the syllabus. And again, before this video keeps going longer, it's already 15 minutes and 28 seconds, reach out to me with any emails. Just remember, communicate with me, and I'll help you guys out. Okay? Thank you. If we need to do YouTube videos to help me explain things, that's fine as well. But I'd like to use Zoom more. Okay? Thank you so much, and take care.